Hi, it's Dr. Julie Steinauer. I'm excited to come to you live today from my vision clinic, Vision for Life, and hop on over and take a look at our website at visionforlifeworks.com. So today, let's talk about functional visual fields. What are they really? What does this mean? And what's happening? So I'm getting this little notification. I kind of keep looking in the wrong spot because it's popping up. Sorry about that. All right, let's jump back into things, okay? So what are they? What are functional visual fields? What do they actually mean? What's going on with this? Like, why do you see these things being posted on here all the time for me? Well, it's super exciting actually in our clinic, and I have two patients to spotlight for this. One is Gabby, and then the other one is Andre, and I'm going to kind of discuss what are they? So functional visual fields is a little bit different than your typical visual field, and certainly a whole lot different from the field test that you take when you go to the driver's license facility and they just flash the little lights off to the side to see if you're actually seeing peripheral vision, right? So functional visual fields are looking more at, like, how is the brain processing information that it's seeing, and are you able to locate motion and movement of things? Are you able to locate specific details? So it's kind of calling on two areas within the brain, which I won't get highly technical about it, but two areas within the brain to make sure that those two areas are functioning really well, these two cellular levels. And if they are, then your functional visual field, or also called attention visual field, will be spectacular. If they aren't, however, it's going to fall short. So let's look at and highlight our two patients. So the first one that I'll start off with is Miss Gabby. And Gabby, she has some interesting information. Let's take a peek at her. I'm going to grab her information. I had to work on getting these together to show. So Gabby's very first field when she came in to see us, after having several brain injuries and accidents, kind of looked like this. All right, this little circle, I got it, this is like on a camera, but it's also flipped, so it's like backwards flipped and all kinds of crazy stuff. Okay, so this little circle right here that you can kind of see, this one is how big her functional field was when she first came to see me. And the date on this one was back in June, on June the 30th. Now, Gabby had, again, multiple head injuries. She's a teenage child and or teenage girl, and she's just struggled through a lot of things as a result of those head injuries. So we've been using some light therapy, some photosynthetic light therapy, and applying it and helping Gabby to be able to open up her functional field better so that it helps take away some of her dizziness, some of the headaches and different things that she's experiencing. And this particular field that I'm going to show you next was actually on August the 8th, and you can see it's much larger. Okay, so before we kind of had this little circle right here, like right in the teeny tiny area in the very center. Now we have this bigger, larger, more functional field. She's feeling a lot more stable, having less issues with dizziness. Headaches have subsided considerably, and she's just overall feeling a lot more kind of grounded and more comfortable. And this is after a long time of dealing with some issues because of having head injuries. So this is a huge relief to her. So now what else? Let's talk about one more patient. We're going to spotlight Andre next. And on Andre, I'm looking down here because I had to prep these ahead of time so that I don't share any identifying information for our patients. Okay, so now Andre, this first one was taken on May the 4th, and I'll show you. Okay, this is his right eye. And it's kind of small, okay? The next one, but certainly not maybe as significantly small as what Gabby's was. The next one was on 7/11. Okay, so on July 11th, it's gotten a little bit wider and broader. And then the most recent one, which was August the 1st. Same eye, we've gotten larger, okay? So by applying the correct filters, which are specific to each individual patient's needs, what we're able to do is take a really restricted area that the brain can process and function in visually and open that up. So now let's talk about what would this affect. So the very first thing that we have to think about is reading. So if you had a, say, toilet paper tube or a paper towel tube, and you could take that tube and put it in front of your eye and look through that and pretend that that's the only thing that your brain could really function with and decipher at any given time, how well would you be able to read? How well would you be able to read if all you could look through was that small little tube of vision? And so kids and adults who have that small tube of functional vision will actually struggle quite a lot with reading. They'll be inefficient, they might skip words, skip lines, forget what they've read, and so comprehension can be really thrown off. So that's the reading side of it, but obviously that would affect everything in terms of schoolwork. Well, then there's the sports side. So let's just say that your child is playing sports and they have this teeny tiny tube of vision that the brain can process at one particular time. Does this sound like a healthy, safe kind of a thing to be doing, like, let's say, playing baseball or softball? No. Okay, so the problem is these kids, especially if they're younger, they're going to be the kids who are out there just totally confused and picking up daisies and watching the bees go by, and they're not going to be paying attention to what's going on the field. And you know, honestly, they could get injured that way because they might not see the ball coming at them and get hit in the head. All right, so if they have this small functional tube of vision or small functional field, then playing sports can be a challenge. They might actually be very uncoordinated, or they could be really coordinated. So there's just different sides of the coin here. Everybody kind of can use their own skill set. We never know what that skill set might be. They might come in super coordinated and have this teeny tiny tube, or they might be very uncoordinated with that teeny tiny tube. So if they're uncoordinated, they're probably not riding a bike either, and that's kind of all linked together with this. So if we're talking sports, then it would really be important to open up and get a very broad field of vision, much like what we've been able to do with Gabby and Andre over the course of a couple of weeks. Now, the other thing that's associated with this one, let's talk about, is behavior. So if you have a child who has a teeny tiny tube of vision, in the classroom, they're going to look highly distractible. Even at home, they might be highly distractible. So you might feel like you need to get them excluded, off to the side, like let's put them in a room where no one else is around so that they can perform their duties of homework. Because if the other kids are running around, if the dog's running through, well, then they're watching that and pay attention to that. They're not really paying attention to what they need to do for homework. Well, in the classroom setting, it's not any different. They're going to look extremely fidgety, very distractible, non-attentive. That makes me think of something. Gosh, what also looks like that? Hello, ADHD. All right, so some of these kids who look like they're ADHD, or maybe even we can toss other things in there, reading problems like we talked about before, like dyslexia or learning disabilities, we might think those are the things that are going on, and yet, oh my gosh, what if it's actually just they have this little teeny tiny tube of vision their brain can really process, and that's the only thing they can process at a given time. So it actually can affect behavior and our ability to stay on task, our ability to stay focused and attentive and not be fidgety and squirmy. And so many children who are ADHD who come into my clinic, whenever I test them, have these little bitty teeny tiny tubes of vision. All right, so now for those of you who have kids who are fidgety, squirmy, they don't pay attention in the classroom, it's a struggle, and maybe it's a struggle at home with homework, then I want you to go get a paper towel tube. And if it's on the roll, do it through the roll. Who cares? That's even better, okay? Take the big honking paper towel, put it in front of your face, look through that tube and go, that's all my child can process at one given time? Are you kidding me? No wonder they don't sit still. All right, they're going to move around and sample that tube all over their environment because it's an issue of just trying to be safe and just to know what's going on. What if there's noises and scary things? They don't know what it is. Choop, they're going to turn around and look at that. Okay, so the other time that this is super duper important to think about is driving. So for our adults, if we've got this teeny tiny tube of vision, we have adults who don't like driving, especially at night. And they don't like driving on the interstate or with a lot of traffic. All right, so it's actually going to affect certain skills, like everyday life skills that we need to, we need to be able to drive places, right? And feel safe and comfortable doing that. If you're a person who's driving and feel like, boy, I have to turn all the way around in order to see what the heck's going on around me, I can't really use my side side vision over here and I can't really utilize my mirrors. I'm not comfortable with that. I feel like I have to turn all the way. Well, that's dangerous. You can't just turn all the way around and not be focused on the road. And so oftentimes, though, what we see is these functional fields have shrunk down for a couple of reasons. One, maybe they were never opened up. Maybe there's some sort of issue going on there. But most likely what usually is the case is that they've shrunken down and they've gotten smaller over time. The brain will decide that too much conflicting visual information, because this too wide system isn't working well together, it's just too conflicting. So in order to make things better, what the brain will do is it will shrink down this field, and so it will become a better functioning field. All right, and there's less attention that's needed for this smaller field as opposed to, gosh, everything all around us. And so our attention can hone in a little bit better if we're struggling with two-eyed vision, and get out some of that distractive stuff that's going around. Some of those things maybe that are like too complicated. To look at that, it makes me feel dizzy, or it makes me feel like I can't stay focused because there's just too much noise and clutter around. So the brain will select out that noise and clutter and try to make things better. And that's where that functional field will shrink down and shrink down. This happens for adults, it happens with children. It's normal and typical for it to happen when someone is sick or in highly stressful times. It's like the brain honing down on what actually needs to occur for, life and for what's most important. But whenever we're talking about a normal day, no one's sick, no one's through a lot of stress, it's just normal life, this field shouldn't be shrunk down. All right, and if it is, there's going to be a lot of problems. And what will it affect? Well, just to repeat and go back, it's going to affect things like reading, sports, behavior, and also driving a car. Now there's tons of other things we can toss in here, like fear of heights and all kinds of things. All right, maybe motion sickness and all kinds of different things. But we're trying to kind of keep stuff simple today. And just to go back and just show you what we mean, let's go back and revisit Andre, whose field was this back in May. Okay, we kind of took him through a progression of things getting better, but I'll jump to the biggest one that's most recent. I'm throwing papers, all right? Most recent here in August. And so we actually have the ability to improve things through this photosyntonics and light therapy. I've given you some examples today. You've seen what it looks like to actually make the improvement down on paper, but then some examples of what it can affect. And of course, the benefits to improving this are mind-boggling. So I hope you've enjoyed this information today. Thanks so much for joining me live. I'm going to try to do this on this page once a week, just to give a little bit more information and dig farther in depth and maybe highlight some awesome patients of ours. I would love it if you comment. Tell me if you're watching it on the replay, if you watched it during. Ask any questions that you would love to ask me. Maybe pass it along, share it with other people. And with that, I'm going to say see ya and be awesome. Have a great day.